Hello, I'm David Gross, and today I'll be leading you on a path of discovery. We'll be exploring an aspect of life that can be hard to face up to, and oftentimes leads to very challenging questions. As we progress in years, there usually comes a time when we're unable to meet our own needs. We need some assistance. We may have family we can count on, but oftentimes the level of help required goes beyond what family can contribute. This change from total independence that we've become so used to can be scary, and no one likes that feeling of helplessness. So, to aid you on your search for what may work best for yours or your loved one's situation, we've brought together a panel to ask questions to help shed some light on the matter. We'll hear from an actual family physician, getting his thoughts on this, and find out from a professional and medical standpoint what you should be considering. We'll also hear from Emily Chambers. She has an elderly parent who's having more complicated medical issues than she can handle. Also, we'll be checking in with William Ferguson. He's spoken with his physician as well as his family, and he's in the process of selecting a home with the skilled nursing care he's looking for. We'll get his all-important take on the matter at hand. Along the way, we'll hear from the care partners at a local elder care home to see how they address the issues brought up by our panel. Now, without further ado, let's go to our local physician.
In my opinion, whenever you're looking for a skilled nursing facility to go to, there's certain things that you do have to look for. For instance, let's say you just had a hip surgery or a knee replacement and it's something that's planned and you know that you're going to need some rehab. That's exactly what you do, is you take a look at wherever ideally you're going to get the best rehab. You want to look at a facility where they have multifaceted care. They might have the facilities to help if that memory reaches a point in its decline where your loved one might need help with those what we call activities of daily living, which would include bathing that individual, helping that person with their dressing every day, getting their clothes on, helping with personal hygiene, helping with making sure that their dietary intake is appropriate, and helping with meals. You would also like to see a nursing home where if you're walking through, the residents of the nursing home are up and about as possible. They might be in wheelchairs, they might be rolled from one place to the other, but it's nice to see them going to activities, it's nice to see them taking part in a variety of different things, because that tells you that that nursing home has truly taken a vested interest in trying to get that person a good quality of life. And that's probably one of the most important things that you'll see.
With those medical concerns in mind, let's check in with some staff members, also known as care partners, from a local elder care home, the Chicora Medical Center, and see how they handle those all-important medical needs.
Here at Chicora Medical Center, we offer a wide variety of services. We have long-term care to short-term care. And in the long-term care aspect, we offer dementia care with a specialty neighborhood that we have for our residents or neighbors here. We also have long-term care as far as skilled and non-skilled services, and in that I mean specialties for wound care, for IV care, for medication administration and nutrition administration. We also offer just long-term care for the residents who need to be here for the rest of their days as related to any hindering health conditions that they have. We also have short-term rehab services that we provide to a lot of residents for different reasons.
We offer 7-day-a-week therapy. We offer occupational, physical, speech. We also offer E-stem for wound care. Our therapists are very good at what they do, but they're also very personable. And I think that makes a big difference, because we offer the same therapist every day and they get to build a relationship, and that helps in the therapy, how they're able to advance and be able to go home.
We have probably 65% of people coming in here go home. They're here for short-term rehab to go home. My job is to make sure that that's a smooth transition for them. I meet often with family members to ease them into coming into the nursing home setting.
We do all their medications, we provide them with their meals, assist them with making a doctor's appointments if they need assistance with that, or set up appointments for them, get them transportation to their doctor, make sure all their medical needs are being met.
As the RN assessment coordinator, I kind of monitor and keep track of medical conditions. We keep track of the residents that are in active therapy, anybody that is currently receiving skilled services here in the nursing home. We meet with the families on admission on at least a quarterly basis, and then anytime anybody has any changes with regards to their medical condition.
Something you might find interesting here at Chicora Medical Center is we are already using an electronic medical record system. So essentially that just means a computer system. All of the staff are trained to document, record, and track everything regarding a resident's care and their status in an electronic medical record. And this helps to improve our care here at Chicora Medical Center because that increases efficiency, continuity, and communication.
While the medical insight is so important, we can't forget about the loved one's family and the questions that they have. And for that, we turn to Emily Chambers.
My name is Emily. I'm here to share with you a bit of what I've been going through with my mom. Let me start by saying that my mom is my best friend. She came to live with me about 2 years ago. She moved in when things began to get a little difficult in her everyday life. I saw that I could help her with some of the basic necessities, and it was great. But then Mom began forgetting things. At first it was minor and you could just chalk it up to old age. But then I began to notice patterns of forgetfulness, and it became more serious. She would forget to take important medications, or not know where she was for a minute, and even have trouble coming up with her grandkids' names. So we went together to visit her doctor. And that's when they told us that she was in the beginning stages of Alzheimer's. Much as I would want to be the one to take care of my mom, I know that she was going to need a whole lot more than I could do for her. Now, I'm not the kind of person that can just give up and put their mother in a facility and forget about her. So I made a list of concerns that I have that I need to have addressed before I'll allow her to move into a home. I need to know that the people that work there, the nurses and the other staff, will care about my mom, will listen to her and spend time with her. I need to know that when I go there to visit, I'm going to feel welcome and like I'm just going over to Mom's place rather than to some sterile hospital-like setting. I'd like to know that she can go outside and still be in a safe and secure environment. I need a place where even though I'm not with her, I know that my mind can rest easy and that I don't need to worry about her constantly.
Ms. Chambers' concerns are real. Let's go back to the Chicora Medical Center and check in not just with the staff, but with actual residents and see how their home might meet Emily's criteria.
Chicora is a member of the Eden Alternative Registry. Being a member of the Eden Registry means that homes have dedicated themselves to pursuing a brand new way of working and living in long-term care.
You may hear several people talking about referring to neighbors instead of residents. We have chosen as part of our Eden culture to use the term neighbors. Everybody's here as neighbors, whether you're staff, your residents, your community people coming in. We try to involve the community as much as we can. We do have great community support here. And I believe that that also makes it a little bit easier coming to Chicora Medical Center because everybody's neighbors, whether you're receiving care or giving care.
What I like about it the most is the staff. They're terrific. They've been very, very kind to me. They had very good therapists, and they would work on me, I think it was 3 days a week.
When we build relationships with each other, the care partners and the residents develop a relationship which actually affords the residents better care. When you build a relationship with someone, you begin to love them. So you are going to give them better care.
The aides and the nurses are just like family to you. In fact, several of them have been gotten very close to me, and I've only been here a little over a year.
Our final panelist of the day has an important view of this whole situation. He's William Ferguson, and he's looking to put a plan in place to help him move into a home when the time comes.
Hello, I'm William Ferguson, but my friends call me Bill. I'm 76 years old, but I don't feel a day over 75. I was talking with my son the other day. He lives out of state, but he came up for a visit. I told him that some things were getting to be a bit troubling for me, and I might need a hand from time to time. He told me he'd get me a butler named Jeeves. I said no. I was serious. I think maybe I better check out my options from here. Now, I'm not too proud to admit when things aren't what they should be, but I'm getting up there, and I gotta know where I'm going. But I also want to make sure it's on my terms. So here are Bill's terms. I want to make my own decisions, like having a choice of what I'd like to eat and when. I want to be surrounded by people who like to do what I like to do. I want to be involved. I don't want to be alone. And I also want to know that I can afford to do these things. I haven't been a burden to anybody for over 60 years, and I don't see why I should start now.
Bill knows what he wants. Now let's see what Chicora Medical Center has to offer him.
We tour the building, see the different, the therapy room, state-of-the-art therapy room, the chapel, which is something that's very rare, I believe, in a long-term care facility.
The chapel is beautiful with the little stained windows. I've been at their services on Sunday.
I like the Bible studies very, very much. We have a very good instructor. She's the chaplain here.
We also have a personal care which is attached to our skilled care. And that's very unique as we're all under the same roof. That way, if you go to personal care and need skilled, or you're in skilled and can go to personal care, you're just in the same building, you know the same people and a lot of the same staff. So that makes it a lot easier.
We have worked very hard with our changes with Eden. We have a choice menu now that we give to our family, our residents, and they can pick from that, choose from that menu every day meals if they don't like what we have. So that is one of the few things that they still can have command over is choice, and having the desserts, the brunches, it's more like home. And this is our home.
We put on a lot of parties, like for every holiday. St. Patrick's Day, it's all green everywhere. We decorate the building, so everything always is decked out for the holidays. The activity department will help them put together crafts.
Chicora Medical Center does an annual car cruise, which kind of brings it's considered a community give back, where the community is able to come up and take part in this event with our residents and neighbors. The residents come out, they get to see the cars, they get to mingle. Some of our older gentlemen here love seeing the cars. It's kind of something that they can step back to.
We always have a lot of entertainment that comes in. We have a accordion player, piano player. He comes in once a month.
They have movies, and of course bingo's a regular thing. We have a lot of entertainers come in, musicians. There's just always something going on.
I hope we've covered topics that are relevant to your situation. Our goal today was to shed some light on the process of selecting the right nursing home by looking at real concerns from varying points of view. Thanks for your time. I'm David Gross. If you're interested in learning more or touring a local home, then go to www.qualitylifeservices.com or call Chicora Medical Center at 724-445-2000 to schedule an appointment to take a tour.